Just like ECGs are a fearful topic for the internal medicine doctors, a same fear comes up with CTG in obs-gynae people. CTG is cardiotocography. That means it is an ECG of the heart of the fetus along with the contractions of the uterus. Cardio means fetal heart rate tracing and toco means uterine contraction tracing. So it's very similar to an ECG. Now, a doctor posted in Obs and Gynae, you should jolly well know how to read a CTG. The basics of CTG starts with identifying different accelerations and decelerations because they carry profound importance in choosing prompt intervention. Now, fetal heart rate variability can occur as in fetal heart rate acceleration. There can be early deceleration. That means the deceleration is occurring just before the uterine contraction. So early deceleration, or it can be a late deceleration. That means the deceleration is occurring after the uterine contraction, or there can be a variable deceleration. That means the deceleration does not correspond with the contractions of uterus. That means they can occur early, they can occur late, or they can occur with the contraction. I have 3 very easy mnemonics to help you remember the clinical significance of fetal heart rate acceleration and decelerations. The mnemonics are wheel, chop, mine. So wheel represents the pattern of acceleration or deceleration. That means V will represent variable deceleration. E represents early deceleration. A represents acceleration. And L represents late deceleration. The chop represents the cause of this acceleration or deceleration. That means C represents cord compression. H represents head compression. O represents it's all okay. And P represents placental insufficiency. And the final mnemonic, mine, represents the management of the conditions. So M represents maternal repositioning. I represents identifying the progression of labor. N represents no intervention. And E represents execute intervention. Then that means you have to do some intervention to correct the placental insufficiency. So now if we check all the mnemonics one by one, we will get to see a very simple pattern. That pattern will be for variable deceleration, the reason is cord compression and you have to do maternal repositioning. For early deceleration, the cause is head compression and you have to identify whether there is a progression of labor or not. For acceleration, it's a normal finding and signifies a healthy baby. So no intervention is required. And for late deceleration, the cause is placental insufficiency and you need to execute some kind of intervention. So these 3 mnemonics, that is wheel, chop, mine, will help you to identify the causes of different patterns of acceleration and deceleration and the management of the cause.